So the G7 in 2017 set up a process which is now described as the T7, which involves a variety of different sectors and groups to provide civil society, business sector, industry sort of input into what leaders should be considering. And so as part of that process, a group was formed called the T7 Taskforce on Global Health. Understandably, health has been a key priority of the G7 for many years, but the pandemic had brought that to much more prominence as well. And so the T7 focus has been a civil society engagement process with think tanks as well as universities, headed by 3 co-chairs, and I've been supporting the co-chairs in that activity in developing a series of policy briefs from a variety of different organisations across the world, as well as then the co-chairs' policy brief and recommendations. G7 members have to fulfil their existing pledges. So we've seen over the last couple of years since the start of the pandemic, G7 members make a number of promises or pledges with regards to things like supplying vaccines, and we're saying, number one, let's deliver on those because there's many parts of the world that still don't have ready access to vaccines. Beyond that, we're looking at how do we start to defragment global health as a field. What we've seen over the last couple of decades has been a proliferation of global health actors, and that's been advantageous in some respects because these organisations and groups have been created for very specific health purposes, and there's often an assumption that you end up with much more efficiency when you have an organisation which is just focusing on one particular issue, and that's fine. But also the downside of that is that you've got a whole bunch of actors now that are all competing for attention, for resources, trying to implement programs in countries, and it becomes a very crowded space. And so we're looking at how can we streamline and make things a little bit more efficient. That way we sort of improve spending in these areas, and we also hopefully have better impacts. So there's some recommendations there, such as setting up interagency standing committee on global health to help try and coordinate all these different actors, as well as some other recommendations with regards to then a new Planetary Health Taskforce, looking at the interrelationship between climate change, animal health and human health, because we're seeing so many impacts coming from climate change. And we just know that climate change is going to have a very big impact moving forward on human health and well-being as well. So there's a whole lot of work which we really need to get underway in those areas. So those are just some of the recommendations that we've been looking at. We're looking forward to the G7 to demonstrate leadership in partnership with other countries as well. That's one of the key themes or key issues which is becoming really apparent. We can't just continue to have Western high-income countries setting all the rules without having conversations and dialogues with low-income and middle-income countries.